Hello again. Welcome to Ask Dr. Pane, where we take your questions and answer them the best we can. This is kind of a generic question. Somebody wanted to know about what they can do for a secondary breast implant or breast implant revision. And we don't have a lot of information with it, but what I would say is there's a wide variety of things that can be done. Now, keep in mind, it's easier to do a breast augmentation than it is to do any of the myriad of secondary operations that might be desired or sometimes needed because of things that can happen with breast implants over time. So you'll see a lot of doctors that do breast augmentation. They may or may not be plastic surgeons, but even among trained plastic surgeons, not all of them do the full range of the secondary type of procedures because it gets tricky. There's a lot of variables. Do the implants need to be changed from above the muscle to below the muscle? Are they ruptured? Is one ruptured on one side? Has there been drooping of tissue over the breasts? Most of it is pretty standard for most people that do plastic surgery. But when you get into some of these secondary things, it can get complicated. So what I would say is you're going to have to get an in-person consultation, or at least provide detailed history and photographs to the surgeon of your choice. You're going to have to see what your goals are, explain it to them, and then you're going to need an in-person consultation in most cases. Now, if you get the sense that you're being told something that maybe doesn't add up or what you think is right, then you might want to check with a couple of different surgeons until you find someone you're comfortable with. In our practice, again, we don't say it to be boastful or anything like that, but we have a fair amount of experience doing both primary and secondary breast procedures, and we will handle just about anything that comes in. Where we make some exceptions is if people have insurance paid type work where they have a breast reconstruction for cancer, something like that, they may be better off seeking a surgeon that's in their network. So some of those we will turn down, or somebody that requires things that have to be done in the hospital, because we do primarily, our practice is mostly outpatient, although we do some hospital work in special situations. So that should help. Again, it's a wide possible array of things that could be needed. So seek a consultation. You may be more than one, and hopefully you will get the result you were looking for. Thanks for the question, and we will see you next time. And if you have a question, you can send it directly to any of our channels or directly to the email at drpane@acplasticsurge.com, and we'll get an answer for you. Take care.